My name's Jonathan Hargreaves and I work for TRN Training. The topic of this session is female genital mutilation, also known as FGM. Female genital mutilation comprises all procedures involving the removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. This is as defined by the World Health Organization. 3 million girls each year are at risk of FGM in Africa. The World Health Organization categorizes FGM into 4 types. Clitoridectomy is the first, then excision, infibulation, and finally all other procedures to the genitalia of women for non-medical purposes such as pricking, piercing, incising, scraping, and cauterization. The practice of FGM violates children's rights as defined in the Convention on the Rights of the Child. Even if the girl child is aware of the practice, the issue of consent remains, as girls are usually too young to be consulted and have no voice in the decision made on their behalf by members of their family. On the other hand, adolescent girls and women very often agree to undergo FGM because they fear the non-acceptance of their communities, families, and peers. In many communities, FGM is considered an important rite of passage into womanhood. Girls may be outcast socially if they refuse, including being unable to marry. The type of mutilation practiced, the age at which it's carried out, and the way in which it's done can vary according to a variety of factors. These can include the woman or girl's ethnic group, what country they are living in, whether rural or urban, and their socio-economic background. The procedure is carried out at a variety of ages, ranging from shortly after birth to sometime during the first pregnancy. Although not always the case, it's most commonly occurring between the ages of 0 to 15 years of age, and the age is decreasing in some countries. FGM is usually performed by traditional practitioners using a sharp object such as a knife, razor blade, or broken glass. There's also evidence of an increase in the performance of FGM by medical personnel. The consequences of this procedure can be immense. It can result in death through severe bleeding, leading to hemorrhagic shock, neurogenic shock as a result of pain and trauma, and overwhelming infection and septicemia. The pain inflicted by FGM does not stop with the initial procedure, but often continues as ongoing torture throughout a woman's life. Additional risks and complications from infibulations includes urinary and menstrual problems, infertility, later surgery, and painful intercourse. When giving birth, the scar tissue might tear or the opening needs to be cut to allow the baby to come out. FGM is a crime in the UK. The Act of 2003 extended the ban on female genital mutilation to address the practice of taking girls abroad to undergo FGM procedures. It also increased the maximum penalty from 5 to 14 years imprisonment. UNICEF in February 2021 stated that worldwide there are 4 million girls and women at risk of female genital mutilation each year. For those of you wishing to explore this topic further, there is a government leaflet on this subject. If you're worried a child is at risk or has already had FGM, there are support lines as laid out by the UK government. All it remains for me to say is thank you for listening, and I hope to see you all in the near future.